Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The area of interest is the upper right forearm. There is a suspected fracture which is indicated by a doctor. Now we will take you through each of the sections so that we can see clearly as to what the tooth is showing. So on the axial view, this is where we can see this is the crown structure right here. We can see that the root canal treatment has been initiated. This is where the chamber opening is. You can see two canals. Here is where we can see a opening between the two roots interradicular area, which opens into the crestal spaces on the mesial aspect. So there is one fracture line that we can see here, which is a clear communication. We can also call it strip perforation, but we can see that this is a fracture line extending on the mesial aspect of the tooth. If we look at this point, particularly on a proximal view or from a coronal view, so this is where we can see that there is a line which is extending between the two roots, and we can see a radiolucency in this area as well, right? So if we can move in, this is where the radiolucency and this is where the fracture line can be seen extending into the interradicular spaces. Now, if you look at from a sagittal point of view, we can see there is a radiolucency on this root, which is basically this is where the communication is in the interradicular area. Now, if we move further down into the towards the apex from the axial view, so the two roots separate, we can see a little bit of a radiolucency associated right there. So this is the radiolucency which is causing opening of the cortical plate as well. We don't see a crack this deep, but we do see that the radiolucency is creating an endoperiodontal lesion on the buccal root. Now, the buccal root is quite significantly shorter in height as well. You can see that here that this is the buccal root. It is approximately the working length of the buccal root will be approximately just 16 millimeters, and the working length for the parietal root is going to be 20 millimeters. So there's a huge difference between the length of the two roots as well. Both of them show signs of periapical radiolucency, and this is where we can see that there is a slight communication in the interradicular bone as well. So there's not a clear cut picture, but we do have signs, and we can see on some slices that there is presence of a crack leading to a periapical and in an interradicular infection in this tooth. Thank you. If you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.